Hello, this is another case study. This case study looks at a case on the molar areas here that we want to talk about a little bit about the ridge height and where you're borderline red, yellow. So that would be the orange category. We have an orange category of the ridge height on this side. And let me click that a little bigger. So right here on this side. And we're going to look at the ridge height here. So you have a little bit more of an orange here and a little bit more yellow here. What's interesting about this case is that in this case, the primary chewing area is deficient by 1/3. This patient is only chewing in the front. This tooth doesn't really matter. It's in the secondary chewing area, and he needs to save this one. You can see a large cavity here. Now, what was interesting about this case is that all of these teeth that are weak by the root canals have been splinted together. And that's actually pretty appropriate for him missing his back teeth. When the teeth are missing in the back, a person starts chewing more excessively in the front, which puts more of a load on the front. And the opposing teeth here that are going to take the extra stress have a problem because they're all root canal treated and they're going to be very weak. If these were individual teeth here and only a 3-unit bridge here, these teeth would be in jeopardy of fracturing or breaking. But in this case, they're all splinted together. It's not something I would have done intuitively. That's one of the things that we typically do not do in the United States. This was done in Europe. But when you look at from here over, he has only a choice to do a full bridge, and I guess they elected not to do any implants and grafts here. You can see that the ridge height and the sinus is a problem in that first molar position, and maybe that's why they didn't want to go through all the surgery to kind of reconstruct the bone or try to help that situation out with implants. Here he could have possibly have done that with an implant, but it would have changed the smile line with the patient. So this case is really looking at how do you bring back the utility of the back teeth so you're not loading the front too much and giving back the patient a primary chewing area. So when we look at this site here, we're going to just turn this sideways for the implant. We want to look at the bone here. The bone is pretty good. It's not super heavy, so I give him a little bit of a little bit closer to an orange on the bone density. He's not super heavy. He's about right. It's just a little bit lighter, and if I go through the bone a little bit more, you can see how much more lighter it actually is. So in this case, he's going to get an orange on the bone density. The nerve height is actually a green because it's pretty far down there, and when we put an implant in into these sites, they actually show up pretty nicely into the area because we have a lot of bone away from the nerve area. So if we go to the other side, here's where we have a problem with the facial bone. When this tooth was extracted, we lost a lot of facial bone here, and that created a weird dynamic. But here the nerve is still going way down here. This is where the bone is a bit less dense as well, and it's sometimes hard to determine exactly where the nerve is because he's got these blotches of holes in there. So the bone characteristics are also a little bit off for the age of this patient. But after that, the question is does this load correctly? So when we talk about that, we're trying to put a tooth in here, and what we want to do is make sure that there's a compressive load between the upper tooth and the lower tooth. And luckily, the way his arch dynamics are, it actually allows a pretty solid direct load over the implant that we're planning on placing. So I don't know if that's because the bridge was made in, or that when this tooth was lost, maybe it was at an angle or something. I'm not really clear. But this is a pretty good case for an orange case on the ridge height because the nerve is very low and the bone density is kind of borderline. So that's a good one.